Hello everyone and welcome to the iCareTech 2020 International Conference on Rehabilitation and Assistive Technology. I'm going to present a paper entitled Aerobika as an evidence-based physiotherapy procedure for COPD and the proposition of a smart OPIP device. I'm Saad Ghaben and this paper has been written with collaboration of Dr. Muhammad Akel from Mechatronic Department and a group of physiotherapy and engineering researchers. First, literature has defined the COPD as a common, preventable, and treatable disease that is characterized by persistent respiratory symptoms and airflow limitation that is due to the airway or alveolar abnormalities usually caused by significant exposure to noxious particles or gases. First, COPD is stand for chronic obstructive pulmonary disorder such as asthma, and other kind of chronic pulmonary problem. Chronic means that this kind of disease will stay with the patient for forever. This kind of disease is characterized by three main characteristics. The first one is dyspnea on exertion. Dyspnea is difficulty of breathing on exertion when performing activity that puts load on the pulmonary system. The second characteristic is the secretion production, and the third one is cough. This is the COPD. At the diagram here or at the figure here, we can see that through year of life, the COPD can start at the mid-age mostly, and usually it's affected by different factors, including the exposure to the noxious particle, and the most important factor is the smoking. With years over life, we can see here that with the advancement of age, there is move toward disability and death. So it's one factor of disability because lung tissue providing body with oxygen. So if we have problem in the lung tissue, people can't do activities. So because they will have dyspnea on exertion, this will lead to disability and final will to death. For diagnosis of COPD, it's the COPD mainly characterized by delayed and incomplete lung empty on exhalation. Normally, when we take a breath, we take certain amount or certain volume of gas. When we expire or take out the breath, a normal individual should expire the same amount of gas. What happens in COPD is some amount of the gas keep trapped in the lung, thus will be accumulated and will increase the residual volume. This volume, as we can see here, the residual volume will increase, and this volume, if increase, then the low vital capacity will occur, and the final outcome we have here, the FEV1 over the FVC. This value is diagnostic for the COPD, and it predicts the stage of the COPD progression. Why spotlighting COPD? Because COPD is the third most common causative factor of death in 2010. The number of deaths were 3 million all over the world due to the COPD. The second factor is the smoking, and I believe that we have so many friends and relatives who smokes, and it's the key factor of affecting COPD. This is why treatment of COPD is important, and finding new modalities for treating COPD is very important. Physiotherapy intervention of COPD. I'm talking about goals of the physiotherapy. The first goal is to manage symptoms. We talked about the three symptoms, the dyspnea on exertion, the secretion production, and the cough. So we are treating these symptoms. The second goal is to control exacerbation, because COPD patients suffer from acute exacerbation where sign and symptom increase dramatically, and they need to readmit to hospital for health care or for clinical care. The last the third goal of the physiotherapy intervention is to delay lung tissue damage. We can't avoid or prevent tissue damage, but we can delay that by physiotherapy intervention and by medical intervention as well. The most important goal of the physiotherapy intervention is to improve the quality of life. And we are talking about the quality of life, we are talking about physical life, we are talking about economical, psychological, social life. So one of our physiotherapy intervention goal is to improve health-related quality of life. To achieve these goals, we implement conventional physiotherapy interventions such as secretion clearance technique. We apply different technique to expectorate secretion from the lung. Another factor, control the breathing technique, either at rest or activities. And here we have variety of techniques. The third technique is the ambulation with the use of the different form of assistive device or assistive technologies. But the idea here is to ambulate, is to move either upstairs, walking out of the house, or doing heavy activities. And endurance exercise training, strength weight training, postural re-education and correction, and the last conventional physiotherapy management is the pre and post surgical intervention if the patient went through surgery. These intervention conventional, which depend mainly on hand technique or physical therapy exercise or patient education. And in physiotherapy we have this dilemma where we most physiotherapy talk about that physiotherapy is a hand-on technique. Like if I'm a physiotherapist, I will apply like manual therapy, physiotherapy exercise, patient education. And physiotherapy is a well-known profession that is a hands-on profession, which depend greatly on applying on hand skill of the physiotherapy. On the other hand, recently we have great strength tower using or implementing high technology or high level technology in physiotherapy, and this is something not common in physiotherapy. Especially in lung rehabilitation or physiotherapy management for lung disorder like the COPD. The mentioned physiotherapy techniques, the conventional physiotherapy techniques lies within the conventional physiotherapy, which is known for most physiotherapists. But application of high-level technology is not that common, and we need to spotlight on this factor for so many reasons. The first reason is that the application of the high-level technology in physiotherapy management is evidence-based, has been tested by experimental studies, and prove the effectiveness of the high-level technology and rehabilitation of pulmonary tissue. The other factor is the application of high-level technology, okay, can decrease the need for direct contact. During the COVID-19 pandemic, we need to find new technologies or new ways to manage patient without the need of direct contact. This is why application of high-level technology or any kind of technology which make the patient independent can use the modality alone without our guidance, or without, we can provide guidance, but can use the modality without direct contact with the physiotherapy. And this is why application of the proposed technique or the proposed device here is of great importance, because it enhance patient independency, it enhance patient management without direct contact with the patient. This is why we need to spotlight the application of these modalities in physiotherapy, because it will support the implementation of high-level technology in physiotherapy. The OPEP devices, the OPEP devices built basic on the mechanical principle of positive expiratory pressure, PEP. OPEP devices including Flutter, Acapella, and Aerobika. And here we are using Aerobika because it's the one that is available here in Palestine. And actually, we found only one piece of Aerobika in Gaza. These kind of devices is not available in the local market, and this is why we spotlight development of these devices. And we are planning to create these devices by the use of 3D printing technology, because it's not available in the local market. While it's not that expensive, but it's not available here. And for the OPEP devices, it stands for oscillation PEP, which is positive expiratory pressure. By using these devices, the patient inhaling more than normal tidal volume and actively expire through the tool through a purposeful but not forceful movement of gas out of the lung for about 4 seconds. Studies shows that airflow oscillations help mobilizing secretions by decrease the viscosity and producing a small burst of air that move secretion near central airways, which improve functional residual capacity and enhance collateral ventilation. Aerobika is a kind of OPEP devices, and it's a handheld, robust, portable, and user-friendly designed to help expectorate mucus from the lung and opens airway. When the patient exhales through aerobica, those continuous resistance create a determined dynamic pressure oscillations, which opens out the airway and therefore help to move the mucus to the central airway. Thus, it can be expectorated. The valve inside the tool switches quickly between upper and lower resistance limit, thus building up positive pressure inside the airway. The Aerobica provides 5 resistant modes to adapt to the patient capacities. Here we are summarizing why we concerned Aerobica and why we are concerned to develop smart Aerobica. First of all, Aerobica has many advantages which put in the advantages for the physiotherapy intervention. It's easy use and handling, so the patient can use it independently, portable and user-friendly, easy to use. The patient can operate the device very easily, enhance independency, and decrease the need for direct contact. And this is very important during the COVID-19, especially that this kind of device is used for lung disorder. And if the patient is affected with the COVID-19, we have a modality that can be used for rehabilitation of the patient without the need of the direct contact. And this is an advantage for this is a significant advantage for the implementation of Aerobica. While if I need to apply conventional physiotherapy intervention, I need to practice physiotherapy with direct contact with the patient. All of these advantages put on advantage for physiotherapy intervention because it facilitates self-administered education program, and this factor has been proven by evidence-based practice research that it enhances the effectiveness of the physiotherapy program. Also, it affects the effective continuity of the care, evidence-based effectiveness, and it requires short treatment time. This is why we spotlighted Aerobica, and we propose a design for a smart Aerobica that it will increase its functionality. Therefore, it will help a patient to practice physiotherapy intervention without the need of the direct contact with the physiotherapy. Therefore, it's very effective during the time of the COVID-19. Now we are going to listen to Siraj Sirsawi, an engineer who, with the with engineering group, has proposed a design for smart Aerobica, thus to enhance its functionality. Okay. Proposition of the smart Aerobika is expected to create more improvement in physiotherapy management for patients with COPD, and we going back to the dilemma that physiotherapy is a hand-on profession and implementation of high-level technology for physiotherapy. We went through research and we found that application of new technology or high-level technology and physiotherapy management for COPD is of great importance and create a high level of physiotherapy outcome, such as the design of breathing exercise game help participate to learn correct breathing pattern in attractive integrated way. The researcher used virtual reality hand-mounted display technology, which allow participants to focus and avoid external distractions. Another technology utilizing Breathe Max device to practice breathing exercise by the use of Breathe Max, which humidify and oscillate inhaled air, and it was effective for facilitating secretion clearance for patients on mechanical ventilation. No adverse effect were recorded. The last technology is the implementation or the introduction of telehealth care, and it can contribute to reducing hospital admission by remotely administering healthcare to patients from home. Besides, it had resulted in possible impact on the quality of life of the participant. Finally, the conclusion of this paper, owing to the promising outcome of implementing technology-based intervention in physiotherapy, it's highly recommended for professionals at academia and the industry to move toward best practice of utilizing technology as an essential measure to improve physiotherapy outcome in the wide spectrum of disabilities and health condition type. Thank you.